Hello, and welcome to Healthcare 4620, Module 3, Portfolio Assignment, Research Study Design. This is a health literacy study. Here's the problem. In the infectious disease clinics, repeat visits for the same illness is on the rise. This might be due in part to limited health patient literacy. The ability to obtain, process, and understand health information is necessary to make informed health decisions. Now, why is this important? It's important to improve patient population healthcare outcomes. It's important to effectively utilize healthcare providers' time. And it's important to help reduce costs to the payer, thus making more medical resources available to many others and bringing down costs. And it's important because inadequate health literacy can lead to poor self-care, worsened outcomes, and decreased likelihood of receiving preventative care and services. It's important because health literacy is a strong predictor of health status. It's important because inadequate health literacy can lead to numerous negative effects on an individual's health and well-being. It's important because poor communication with patients also contributes to unnecessary readmissions and reduced patient satisfaction and engagement. So, what study are we going to use here? Well, the model that we're going to use is a cohort study, which is recommended to determine the impact of limited health literacy on repeat visits. All right, so what does the data collection look like? Well, the data collection is to determine if limited health literacy impacts repeat visits. There will be two groups, those who are seen for repeat visits and those who are not. To identify the participants in each group, the following questions will be asked to check in. Patients, will be given an iPad-type device to answer in privacy while they wait. They will answer each question with one of the following: always, often, sometimes, occasionally, or never. Now, the 16 questions listed can be used by the various clinics depending upon their particular needs. You can use some of them or all of them. The point of it is that you're trying to determine limited health literacy and its impact on repeat visits. Now, once the data is gathered and once the groups are identified, their cases will be analyzed to determine trends in the number of office visits and appointments made by each. Then that data will be analyzed to determine if patients with a limited health literacy have more repeat visits for the same illness than patients with a high health literacy. How to help? How do the doctors help? Well, the doctors can remind patients that the physician is there to answer any questions about their health care. Physicians can ask open-ended questions and follow up with a quick phone call after 3 days. Nurses. The nurses can provide patients with many resources available to learn more about their healthcare plan, like patient portals, educational websites, videos, hotlines, and printed materials. They can also provide a number for the patient to call the doctor with follow-up questions. The clinical office staff. The office staff provides the patient with the survey at check-in. They schedule all appointments and follow-ups, directs patients to the proper provider to have questions or concerns be heard. There are 3 study types. There's the case report study, which actually looks at one case of a disease to determine unique information. That's not for us. Cohort study. Now, we are going to use the cohort study model here because it's a study design where one or more samples called cohorts are followed prospectively in subsequent status evaluations with respect to a disease or outcome. That's the outcome we're looking for. It helps us determine for this study and answers the question, does limited health literacy impact repeated office visits? Case control, which we won't be using, is a study which analyzes multiple cases to find if common factors appear to be linked to a disease. Outcomes. The study aims to determine links between limited health literacy and repeat office visits for the same illness. Yet primary responsibility for improving health literacy ultimately lies with public health professionals and the healthcare and public health systems. They must ensure that health information and services can be understood and used by all Americans. They must engage in skill building with healthcare consumers and health professionals. Adult educators can also assist and be productive partners. And here are the references. Thank you for watching the video, and that concludes this presentation.